Hi, welcome to another episode of Question of the Week. On today's episode, we're going to be talking about dry needling and answering a few questions about that. One, what is dry needling? Two, do you do dry needling? And three, can dry needling help me? But before we get started with that, I want to just give you a heads up to another video that I am finishing up with right now that'll be due out next week. And this will be the end of my three-part series on office ergonomics. This is one where I kind of go on the road. It's a really fun video and look at some stand-up desks and some chairs. So be on the lookout for that video. Okay, so I have been dry needling for about 5 years now, and I still run into some people who don't know that I do this technique. So let me explain a little bit to you about what it is and hopefully how it can help you. So dry needling comes from a term, and the reason that they use the word dry is because it's not wet, meaning there's no injection, there's no liquid involved. It's using a solid filament needle. It looks basically like this. I'll show you what one looks like. They're acupuncture needles. Okay, and it kind of comes in a little tube, and then it's just like that. So pretty small, pretty flimsy little needle. Okay. So I use dry needling when somebody has what would traditionally be called a trigger point in one of their muscles. So a trigger point is kind of a broad definition for what I feel is an area of sensitivity in somebody's muscle where they have a little bit of some pain or there's some tightness there that they can't quite get to superficially, like from like a massage or something like that. That's where I feel dry needling is used the best. It helps the person get range of motion, helps them get rid of some pain that they wouldn't otherwise be able to get rid of. So how the needling helps a trigger point is when you stick the needle into the trigger point and you manipulate the needle a little bit, then the muscle will tend to cramp and contract around it. I think of it as almost like a Control-Alt-Delete. It cramps around it and then it relaxes. Another analogy that I give my patients is almost like a defibrillator, where there's at this trigger point, there's some increased electrical activity, some increased neurological activity that causes the sensitivity and pain there. And just like when they defibrillate a heart, it shocks the heart back into rhythm. It's almost like the needle going into that trigger point or that tender area tends to cause the muscle to contract hard upon itself and then relax and go back to a normal state. And it works amazingly well. Other questions people have about dry needling is it acupuncture? And it is absolutely not acupuncture. If you're under the care of an acupuncturist, you need to continue to see them. It's something that's completely different. We just happen to use acupuncture needles. They also, most people want to know, does it hurt? And you know, in my experience with this, it just depends on the person. Some people feel like, oh, it's no big deal. Some people feel like it's pretty an intense an experience. When the needle is doing its job, it does feel kind of like what you would think a muscle cramp. So you may be wondering, will dry needling help me? Well, that's something I would love to talk to you about because I'm very particular about when I use it. I just don't dry needle everyone, and it is just a tool with hopefully as a means to an end, meaning like I use it as something to achieve a bigger gain somewhere else. Rarely do I just kind of spot treat it, but sometimes that is the case. So if you have any questions or you have maybe a knot or an area that you can't really get rid of the pain and you've been curious about dry needling but wasn't sure if I did it or not, or just had some questions, please either email me, text me, call me, come see me at the gym when I'm here, and just ask me about it. And I can explain to you best as I can and see if it would be something that would be appropriate for you. Thanks for watching, and I will talk to you guys later.